So we have, of our Smile on Seniors board, we have two of the board members that are parents of Dr. Jonathan Lifshitz, who's presenting today. They're on here, Izzy and Pinky Lifshitz. And I figured, or we were discussing this earlier, who should do the intro, me or his mother or father? So the answer was, and the decision was, his mom passed it off to his dad. But before that, I figured I'd just read two definitions. There's a Hebrew word called nachas, which the translation is pride or gratification, especially of the achievements of one's children. So this is part of the nachas that Pinky and Izzy have for their child, Dr. Jonathan Lifshitz. I say child, it makes him sound young. He is young, but that's not how we mean it. He's definitely not young in the sense of wisdom. And so we're very honored that he is taking up his time today to present. I'm going to pass the buck along to Izzy, and I'll spotlight him so you can see him as he introduces his son, Dr. Lifshitz.
Hi, everybody. Jonathan, our son, is a PhD. So really, if you get sick, you need a real doctor. However, he serves as the director of Translational Neurotrauma Research Program, which is a joint venture through BARROW Neurological Institute at Phoenix Children's Hospital, the Department of Child Health and the University of Arizona College of Medicine, Phoenix, and the Phoenix Veterans Affairs Healthcare System. In 2012, he was recruited to direct translational neurotrauma research in Phoenix with a vision to improve quality of life for those with an acquired neurological injury. I'm going to go a little bit off script here and just say that Jonathan is a out-of-the-box thinker. When you're with him, you never know what's going to come from left field. And this is one of his successes. And the traumatic brain injury was just the beginning of his research, and it has branched out into other regions of research. Pinky and I have lots of nachas from him and our other children. And on a final note about that, it's just, I was at a neurotrauma conference with him about 10 years ago. And it was just such a joy to see all these learned professors and scientists looking for Dr. Lifshitz to come and ask him his opinion. And so I'm going to now hand it over to him, and we'll see where it takes us. Thank you.
This is very exciting and a real honor to be able to say thanks, Dad, for that great introduction. Typically, we do extend our gratitude for the invitation to speak. So thank you, Dr. Levi, about that, about the invitation, and Dad for the introduction. I've been doing traumatic brain injury research since I took my finals as a sophomore in undergrad, and continue to work in this field to improve the lives and welfare of those that suffer traumatic brain injury. And so I'm going to start to share my screen, which includes a PowerPoint presentation of what we are working on. The approach that we're going to take for today's presentation is really beginning to give you an overview of what is traumatic brain injury, which many of you have probably read about in the popular media and comes across your news feeds, ways in which to think about it. And then really we're going to turn on to domestic violence, because this is an area that requires our attention, or should have required our attention 100 years ago, and in today's world requires our attention even more than before. When we talk about traumatic brain injury is really a mechanical event. It's the application of force to the head or the face or the neck that causes some injury. One of the easiest ways or the most visible ways to think about it is in a car accident. If you're unbelted and your head hits the steering wheel, the dashboard, or the window, that impact is going to cause a traumatic brain injury because of the forces that are applied to the head. In the media and in today's world, we know that our overseas conflicts, as well as basic training, put our soldiers and our warfighters in harm's way, from explosions, from blasts, from falling, from parachutes, from hitting buildings and what have you. If you were to read the sports pages, and if we actually still had sports going on, you're well aware that at all levels, there's issues with heading the ball in soccer, with tackles in football, with gymnastics that are associated with sports. But today we're also going to take this to the next level where it comes to intimate partner violence or domestic violence that is often focused on the head, the neck, and the skull. One of the take-home messages from today's talk is that traumatic brain injury is not like getting a splinter or a paper cut. It's not something that hurts for a little bit, goes away, and then you forget you ever had it. What I want you to take away is that it's going to lead to a disease process. And so the next few slides are going to get over into this concept of how traumatic brain injury leads to a disease process. But first and foremost, we all know that we're each individuals and we're each individual human beings. And from that, we bring certain backgrounds to anything that we engage in our lives. So before a TBI, you are who you are because of your biology, because of the environment you grew up in, because of your lifestyle and the decisions that you make. And when a TBI occurs, there's also some risk factors that you may bring to the event, such as sleep deprivation, dehydration in an Arizona summer, developmental disorders, or even short-term things like drug and alcohol use that can affect or change and define who you are at the time of a traumatic brain injury. The process or the disabling process as part of that disease is that the brain injury results in some pathology that I will show you, and that pathology could resolve very uneventfully, much like a splinter or a paper cut. However, it is possible also that that pathology of that brain injury can lead to impairment, and that impairment can limit function. If your function is limited, you would go see some healthcare providers who are going to provide some rehabilitation, and that rehabilitation can then allow you to overcome some of those functional limitations. However, the opportunity or the possibility still exists that there is disability that you live with as part of this disabling process, as a part of the disease process associated with traumatic brain injury. And now when we consider those same risk factors that elevate risk as associated with traumatic brain injury, those risk factors can actually affect all aspects of the disabling process. So sleep deprivation can affect rehabilitation, a mental disorder can affect the functional limitation, and ultimately we're focused on how this affects quality of life. And so it's really important to recognize that traumatic brain injury is not this general pot, but it's really specific to each individual. When we talk about traumatic brain injury, there's a variety of adjectives that go in front of and behind them in terms of severity and just a concussion, just a traumatic brain injury. Suffice it to say, a concussion is a traumatic brain injury, and those terms today can be used interchangeably. A concussion is really a complex set of events that occur inside the brain. They start with a mechanical force and they result in clinical symptoms. And this is one of the best flowcharts that I've come about to see this. It's not important to be able to read the text, which is really small, and even in the publication by Kenzie that's listed at the bottom, it's really small. What really I want you to take away from this is the fact that traumatic brain injury does lead to a disease. So the traumatic brain injury starts with an impact to the head or to the brain, which is illustrated here by this red dot. It causes some changes in the cells. Those cells, as they change, they go on and affect other cells, and those cells can then develop into more pathology within the brain and within the body. But as we know, is that body parts are all connected. There's that song that all your grandkids sing about the head bone being connected to the neck bone. And the same way all of our cells are connected into networks. And so networks start to get disrupted. Those networks can be the way in which you think, the way in which you sleep, and the way in which you feel. And then as you change inside in terms of your network, it changes the experiences that you have. And those experiences are the ones that you sense or others sense in you. And it can also include stress and other levels of anxiety and emotional disorders. And then as you profoundly change in this disease process, so does your social network, your relationship with your parents, your children, your loved ones, your job can all be changed. And so just like any other disease that not only affects an organ or an organ system, it does affect your life. Traumatic brain injury can affect your life in the same way. I don't want you to go home or stay home and remember all this about a traumatic brain injury. And so there's an analogy that I can share with you that will allow you to remember this always. And it's quite simply that a primary brain injury, that mechanical force, is going to ripen into the cellular, the network, the experience, and the social changes that we just talked about, the same way in which a banana ripens. Quite simply, a banana has an outer peel like we have a skull. If you were to scratch or flick or break some of those cells in the peel, it releases chemicals that actually accelerate the ripening of that banana. And so there's actually very cool banana art that you can take advantage of. But that ripening spreads from the location where those cells are affected, and it travels not only the length of the banana, but also deeper into the banana, the same way that the pathology of a traumatic brain injury extends into deeper structures and affects a person who they are. And that's really all you need to know about the pathology. It is important to be able to see what an imaging scan of traumatic brain injury might look like. These are CT, computerized tomography scans of brains. This is what a normal brain would look like. Here in white is your skull, the gray in the middle is your brain. And after a brain injury that, for all intent and purposes, doesn't have the fracturing of your skull, the brain looks homogeneous. It looks all uniform throughout the skull. And when the brain is uniform, it means that the cells are swollen, the cells are disrupted, and the networks are disrupted. And so in cases where the injury might be fatal and the brains are collected and they're looked at under a microscope, the type of pathology that you're going to see are illustrated here on the left and the right. And quite simply, the long, thin axons of a neuron, which you can see coming up here in this image. You can see finer ones over here on the left side. And when they break, they cause a pileup, not too dissimilar to a car accident on a freeway. One car on a freeway has a flat tire or stops working, and all the cars behind it back up. Now on a freeway, it doesn't necessarily swell, but in a biological system, as those cargoes inside the cells are moving back and forward, they are going to swell and can be visualized. So this is the swelling of all the cellular components as a result of this damage. And an old friend of mine who's a neurosurgeon, who is a really horrible artist, published this paper, and I just like to showcase his artwork. So Larry Marshall in San Diego drew this as a schematic of how the brain works. We've got one neuron that leads into connecting to another neuron and into another. And this is the way that it would, the brain would normally work. When we see that pile up and that disconnection of those axons, Larry here has drawn this as a cutting of that axon so that this circuit is no longer connected. There is physical damage in the brain that prevents that circuit from working. And we recently had a paper published where we can show, here is one of these axons. We can call this neuron number 1. At 1 hour after injury, there starts to be a shaking or a bending, what we call an undulation in that axon. It's very similar to if you take a rubber band and you stretch it and then you relax it very quickly, that rubber band will have waves in it. And then 3 days later, we were able to find that axon, and here you can see that it's truncated, just the way that Larry drew it 20 years ago. That being said, there's also the opportunity for the brain to recover the same way that when you have a splinter or a paper cut, your skin can recover. And there's two primary ways that it can recover. The neurons can bypass that area of injury, or they can grow through it to reconnect those circuits so you can have some recovery. And I hope you can appreciate that this arrangement looks very different than the original one because it's been bypassed. And we were able to show also that this recovery occurs. Here's one of these axon that is undulated. It's been stretched and relaxed. And rather than going on and forming this car accident at the end of it, it has now recovered and looks healthier as we move forward. So that's the pathology. And when we take this up to a bigger level, the normal brain here is well connected with these smooth connections that cause or subserve a variety of different functions. And as a result of brain injury, those circuits get broken and disconnected. Again, when we go from science into the take-home message, here comes my father's favorite analogy. When we think about the brain as being this connection of neurons, these very elegant networks that serve all the functions that we know about, and we dive into those individual neurons, it's important to look at the anatomical structure. This is the cell body of a single neuron, and it has an axon that extends into other parts of the brain that allow them to connect together, much like old landlines that were hardwired to a telephone network. And when you look more closely, you can see that each of these branches have these spines on them, which are actually the points of communication between neurons. And there's tens of thousands of spines per neuron. Being the father of my parents, or three of my parents' grandchildren, my household is filled with these bricks. These are Lego bricks that essentially have a cell body on that form the size of the brick, and that brick has studs on one side and tubes on the other, not too dissimilar than the cell body of a neuron and the spines that are on it. And what we know about Lego bricks is that they can be connected and disconnected and reconnected in multiple different ways. And when you take these individual bricks and you connect them in multiple ways, you can build phenomenal structures such as a house. So if we think about the analogy of neurons forming circuits that then form the brain, it's easy enough to think about Lego bricks that come together and form a structure. And just like this Lego structure has a variety of different functions, such as a mailbox or a satellite dish, basketball, and a garage door function, we have multiple functions such as balance and taste and thinking and happiness. What happens after a traumatic brain injury? You're engaged in some activity or forces are applied to the skull. That structure then gets disassembled. And the great part about it is it can be reassembled. And it can be reassembled in a manner that looks exactly like that serves similar functions to the original structure. That is a house. And for all intents and purposes, it looks fine. It's still a house and it functions perfectly well, but it is substantially different than the house that it started from. And so what people with a traumatic brain injury complain about is that they have a different personality, that they feel different. And by feeling different, they are different people. And so here we can see new functions like seesaws and picnic benches, but we can see the same old functions such as the front door and windows and a roof. And so some aspects remain and other aspects change. How do we know which ones are affected? Well, when you think about the brain, this injury to all these neurons and the axons and the way in which the banana bruises are scattered throughout the brain. And depending on where in the brain the damage occurs, can determine or does determine those functional morbidities and limitations. And so the categories and types of things that a brain injury can affect fall into three broad categories. The first one is cognitive symptoms. So as a result of brain injury, you can feel slowed down or have memory problems. You can have difficulty reading or confusion. You can have a variety of sensory and motor issues, such as sensitivity to light and sound, incoordination in terms of balance. You can have sleep problems or numbness and tingling as associated with it. And you can even have emotional issues such as depression, aggression, impulsiveness that change who you are. Anything your brain can do, a brain injury can affect the way in which it works. Suffice it to say that this is not a checklist, and once you reach a certain number of checks, you have a traumatic brain injury. You can have a single symptom that disrupts your quality of life, and you can be diagnosed with a traumatic brain injury, or you can have multiple different symptoms that slow you down. Extending on this concept that traumatic brain injury is a disease process, it's critical to know that even though the injury might occur in your brain, there can be effects in your body. And so it's important to recognize that there is a systemic or a body response to traumatic brain injury. And when that traumatic brain injury occurs in the head and affects the neurons and all the other cells there, that those molecules can travel not only through the nervous system, but through your circulatory system and your lymphatic system to affect the lungs, the heart, the liver, your gastrointestinal tract, your kidneys, your bones, in ways that help or continue to define that disease process. And so what I've taken you through now is probably 70, 80, 90 years of research on traumatic brain injury from the cellular level all the way through the social level that defines traumatic brain injury as a disease process. However, the warning that comes with everything that I said is that the vast majority of these research, both in the laboratory and in the clinic that have been conducted in males. And so when you think about even that first slide where I showed you the car accident, the military, and the sport, they were all male related. And if we actually look back into the popular media, in 2010, this is when the NFL started their issues with concussion, or concussion started their issues with the National Football League. And it brought to light that all these high-priced players who were having their hits or having their head hit are not only changing the game, but it's also changing the players, and we have to bring attention to this. And so now we're 10 years after this article where look how bad this issue is. Well, what I can tell you is that 25, 35 years before that, there was a cover of Miss Magazine that very clearly articulated that battered wives are likely in harm's way as a result of traumatic brain injury. And this cover article and the research that it was based on is even more stark. And so quite simply, like professional athletes and soldiers, women and children who are impacted by domestic violence are actually more likely than the general public to suffer traumatic brain injury. And not only are they more likely to suffer, they're likely to suffer it more often. Along these lines, colleagues who I actually just met yesterday published this article at the beginning of this year. And it was quite remarkable. They are medical historians, and they went back and they looked at this issue of why were boxers put ahead of women? Why were war fighters put ahead of women? And they came to a stark conclusion based on a variety of social as well as medical literature. And I've highlighted it there in green versus yellow. And in boxing, which basically means in men, it was taken that these men were soldiers, and therefore there is an anatomical and a physiological grounds for their symptoms associated with traumatic brain injury. With domestic violence, which basically means in women, these symptoms were associated with psychiatric and psychological issues and basically failures of character rather than medical conditions. And this is why it's become an epidemic. One of the issues, or one of the examples that these investigators showed was from the obituary of a boxer named Maxie Rosenblum, who, as you can see here, was a prolific fighter, 274 fights, sometimes fighting 3 or 4 times in a single week. And even his obituary here that I've pulled out that said, despite his 289 fights in which he was attacked, it says here that plenty of wives take more punches than Max ever did, and they bury their husbands beyond that. So back in 1976, this was coming to light, but never took took light. For those of you that follow the literature on long-term effects in our athletes, this was really an aside type of commentary that was published 30 years ago in a prominent medical journal that articulates dementia in a punch-drunk wife. That's basically saying that there's an individual who passed away, and the reports of her husband as well as relatives said that this particular individual had been brutally attacked over many, many years. And when they examined her brain had the same types of pathology that make the headline news in the Wall Street Journal, known as chronic traumatic encephalopathy. Suffice it to say, this article was read by a handful of people, but never made any social impact or change in what we did. And in fact, after 1990, we started following sports and soldiers much more often as a result of traumatic brain injury. Going back to the 1970s, this is when J.J. Gayford was starting to look into this issue. And he basically did a neuropsychological interview and a patient interview with 100 different women survivors of battery from an early domestic violence shelter. And the single the single comment that he chose to publish in his article was very telling of all the others, which indicates that this particular wife was hit with fists and feet and bottles, smashed against the floor, repeated blows to the face and other parts of the body. The extent of the kicking broke ribs and arms. It included strangulation. There were even miscarriages associated with the abuse, and that multiple black eyes, cut lips, and swollen noses occurred. And so this just articulates the violence that's associated with wife battering that was a prominent topic in literature in the 1970s. Of those 100 women, 42 of those wives said that they had no way to reduce the intensity or the frequency of those abuse events. 16 women claimed that they wanted to die, and 2 women had been beaten severely enough to the head, neck, or face that there was retinal damage. And the overall synopsis of these 100 cases suggests that there's low frustration tolerance in the men that leads to this type of activity, may be exacerbated by alcohol, and pregnancy seems to increase this level of abuse as well. So when we think about this type of intimate partner violence, it's typically between a heterosexual couple, but it can also occur in homosexual couples. It can start with yelling at each other. It can lead to hitting and slapping by either partner in that relationship. It can then use or include the abuse associated with implements. It can lead to strangulation and other forms of violence, if not repeated aggression. And that type of violence, at least the severe forms of violence, is almost always a case of a male aggressor against a female victim. And these cases are often go unreported because there are no observers and there's shame associated with it. A question that goes through my head is, why is this violence always focused on the head, neck, and face? And when we think about it, when a disagreement starts with yelling, there might be some profanity that occurs, and that profanity then leads to alarm clocks that go off in someone's head. And that alarm clock is going to raise somebody's anger to the point in which they want to actually shut off that alarm clock. And it's my contention that the source of that irritation is the source of the violence. And thinking through this analogy, I actually went into the literature, I went into the patent literature to try to understand alarm clocks and why they're so frustrating. And I just want to highlight the fact that alarm clocks have changed over the years, so much so that some have actually invented alarm clocks that self-destruct. And I pulled out this particular one, which you basically hit the top of it with your fist and the entire thing falls apart. And the rationale for this is that striking this pad with your fist is a therapeutic moment of self-expression, which may help us to put ourselves in the mindset of an individual who engages in domestic violence. When we look at the epidemiology and the risk factors and the issues associated with traumatic brain injury, domestic violence and traumatic brain injury, there definitely is way too much of this occurring. In this particular table, when asked about the abuse history, we're looking here at abuse that requires medical attention, hospital admission, and the one that actually affects me the most is abused while pregnant or even being caused to miscarry as a result of the abuse. The types of injuries include bruises, broken bones, throat injuries, burning and scalding of skin. And when we look at the location of the injury, it's the face, the skull, the eyes, and the neck that summate to the largest or the focus of this particular injuries. This was in 1991. Our colleagues at BARROW Neurological Institute about 5 years ago looked at 208 cases that came through their brain injury clinic for domestic violence, and they were able to look at their demographics. There's a couple elements I want to show you here. It has no impact on whether what your race is. Domestic violence occurs across races. Many of these individuals were also abused in childhood. It doesn't necessarily have a psychiatric history that makes you prone to this. And the most startling element here is when asked how many brain injuries did a victim have, most of them said that there were too many for them to count. As they move forward to look at the symptoms that the individuals were having, these are essentially all the symptoms associated with traumatic brain injury that I already articulated to you, that include cognitive issues, sensory motor issues, as well as emotional issues. When Amanda St. Ivany did her master's thesis, she interviewed a variety of patients and cataloged the words that they used to describe why they stayed with individuals as well as what they were feeling. And these were the common words that were put forward as to why things were happening. There's a lot of shame associated with traumatic brain injury. There's a lot of regret. There's a lot of obligation, but there's also a lot of medical issues that need to be taken into account. There's actually a very powerful Grey's Anatomy episode on this topic in which the victims are counseled that it's not their fault and they did nothing to deserve this, that there's an opportunity to recover and to get better. And so there is some optimism about traumatic brain injury, regardless of the mechanism of injury, that there are ways in which someone can recover. And so if we look at the pediatric and the sports guidelines on recovery, there are what are called infographics to allow us to get back to those, to a healthy state. So on the left side is our pediatric progress bar. On the right side is the sports return to play. And quite simply, this roadmap says, stop doing what you're doing. If you think you're getting better, try to do a little bit more, like light aerobic exercise. If it starts to hurt, then stop doing it, wait a while and go back and do, and go back again later to try to recover. It's called a graduated return to activity. You basically do what you can until it hurts. If it starts hurting, you stop and then you go back again. But the issue at hand is that what is the treatment for a victim of domestic violence who has been repeatedly abused by traumatic brain injury? Is there such a thing as graduated return and rest? If we take the typical situation of a woman who has a family with a very compressed schedule with multiple household, if not professional duties, there is no way to implement a graduated return or even rest, especially if the abuser is still around. Not to mention all the other comorbidities we already discussed that may be at play while trying to have somebody recover and rest. And so this is a very big challenge. What have we done? Quite simply, in Maricopa County, we recognize that this is an issue, and we said we can't stand by. And moreover, we can't just sit in an ivory tower of a university and do more epidemiology. We have to band together and get something done. What we knew is we had a variety or a broad array of expertise in sports as well as the military to draw on to try to improve what was going on. It also turns out that in Maricopa County, we are a national leader in identifying and treating strangulation, as well as prosecuting strangulation. And so we had that as at least as a framework to build on. And so what we developed, sorry, I'm skipping a couple slides because I want to make sure we have time for questions. What we developed is the Sojourner Center Maricopa County collaboration on concussion from domestic violence. The Sojourner Center is one of the nation's largest and broadest delivery of services for sheltered women, as well as their pets, and they help to lead us into this collaboration. This collaboration starts with police officers who have been educated to understand traumatic brain injury so that when they show up at a domestic dispute scene, they're not seeing a victim as being dismissive, but actually understanding it as concussive symptoms. We have a host of social workers and nurse and patient advocates who are able to further educate, inform, and guide the victims to services that are available. Honor Health and Banner University Medical Center have been able to put together emergency room as well as forensic nursing facilities to be able to catalog any acute injuries. The Banner Concussion Center is our flagstone treatment for a variety of symptoms, both somatic and vision and psychological. While we work with the Maricopa County Attorney's Office to develop ways in which we can prosecute the abusers in order to prevent future instances. And then a part that I am directly involved in leading is the analytical component of understanding new process, new procedure, and the extent of what's going on. At the same time that we were putting this together, two of our senators, Senator Masto from Nevada and Ernst from Iowa, actually commissioned the Government Accountability Office to put together a report on domestic violence and traumatic brain injury. Suffice it to say that their literature work came up very empty, and so they came to visit us for a week, and they're currently preparing a report to Congress on the impact of domestic violence and traumatic brain injuries. And in a couple slides, I'll tell you why all of their work has been for naught because of recent events. That being said, I also lead a project, or actually I lead a team in basic science research, where you can imagine, how are you supposed to do this in a laboratory? How are you supposed to learn anything? Well, I let you know that abuse increases during pregnancy. And how can we determine what's going on? We are able to use animal models to affect this, because we do know that traumatic brain injury not only affects the brain, but also affects the body. And so we work together as a team to apply our laboratory models of brain injuries to pregnant mothers. So we have pregnant mice who are brain injured at a certain time during their pregnancy. They then give birth. The animals are weaned towards independence, and we're able to evaluate these animals in a variety of different tests to evaluate their cognition, their somatic behavior, as well as their emotional behavior. I'm going to show you two tests, one early and one late, that suggests that a brain injury to a mother who is pregnant has effects on the child when the child grows up. And again, this is based on mice. One way in which we looked at it, we looked at the way in which the networks of the brain are connected. On the left-hand side, we have mice who were born to moms who did not get brain injury. On the right-hand side, we have mice who are born to moms who did get brain injury. And you can see this whole is bigger in the black versus the red. And also these squiggles extend further than, these black squiggles above that hole extend further than the red squiggles. I'm trying to explain this as simply as possible. Basically, the breadth of the network of the brain of brain injured animals who are born to brain injured moms is much smaller. So there's a fundamental change in the way in which the brain is organized in those animals. And then moreover, when we looked at how these animals responded to an infection. So we gave the animals an infection like the flu, and we looked at the animals who are control offspring. They had a certain response, and that response was blunted or permanently changed. The immune system was permanently changed in animals born to moms of who had a traumatic brain injury. We've also been successful in getting the Arizona Department of Health Services data. So we were able to get all the data from 2016, 17, and 18, and we identified all the medical events that occurred at a healthcare facility associated with traumatic brain injury. And then we said of all of those, how many had an association with domestic violence. So we have 1,000 individual encounters that integrate domestic violence and traumatic brain injury. And this is 1.3% of the TBI diagnoses are associated with domestic violence, remembering that most of these individuals that are in this situation don't seek medical care. That being said, I wanted to share 3 pieces of data here from these results. One is who perpetrated these acts. Most of these are unknown or unreported, but beyond that, the intimate partner violence is primarily the one that inflicts the traumatic brain injury as a result of domestic violence. And when we ask a simple question, because it was in the records, it was, did you come to the hospital because of a head injury? You know, let's just say that a partner abused somebody and they had a laceration in their arm and a traumatic brain injury. If they came in and said, look, my arm is broken or has a laceration, they would fall into this category. Whereas if they came in and said, no, my head was hurt, they would fall into this category. And what we're looking at here is 2/3 of the population didn't even know they had a traumatic brain injury. And that's really, at least in the adult population, it's regardless of age. But in the infants, most of them didn't know, most of the parents didn't know that the infants had a traumatic brain injury. We're able to map this onto where these occur in the state of Arizona, and specifically develop heat maps for Maricopa County. And so what this allows us to do is to see which facilities we may want to focus our education on. And it turns out these are the 3 downtown facilities of Dignity Health, Banner, Phoenix Children's Hospital, and the VA. And then again, very disturbingly, when we just looked at trends over time, looking from 2016 to 2018 in different age groups, what we wanted to see is which population is increasing and which population is decreasing. The good news is that the young adult population appears to be decreasing, although not substantially. But the children, the rate of abuse in children has increased in Arizona from 2016 to 17 to 18, which is troubling. And so that being said, we're now in a pandemic. We're in a pandemic where families are locked together without much social contact. And so very shortly after this started, this one's from April 6th. These ones are actually from the end of March. You can consider that some individuals are in a state of intimate terrorism, where whether it's an intimate partner and 2 adults, or it's sexual abuse on children, or even violence towards children, the number of encounters where someone can escape is fewer, and likely the stress and anxiety associated with the situation is causing a skyrocket. Suffice it to say that every domestic violence hotline in the country is seeing at least a 30% increase in calls as a result of this. And likely the traumatic brain injury that's associated with this is on the rise as well. And so this is where that Government Accountability Office report is going to fall flat, because any estimates that they have now been surpassed by the current COVID-19 crisis. And so what I want you to take home from this is that our brains do work. They work in absolutely phenomenal and impressive ways. There are things that cause our brains to stop working, such as a traumatic brain injury, and we need to have therapies that will remove those blocks so we can get back to work again. If you know anyone who has a traumatic brain injury, there are a variety of different symptoms that are associated with it. The recovery is very personal, but they can be treated. And with that being said, I get to be the figurehead of a large team. This is primarily my laboratory research team, not the Maricopa County Collaboration on Concussions and Domestic Violence. And I've also reported this as going back to the 1970s, and I hope you can appreciate that this goes back a lot further. And I'll leave you with this startling revelation, and that is shortly after a rainstorm, when the sun comes out, the official term for this is a sun shower. We all stand and stare and say this is wonderful, but in folklore across the world, it really represents or goes back to stories associated with the devil beating his wife with a walking stick. And so if this is folklore from hundreds of years ago, these issues are not new. We've just not had the courage to raise awareness about this topic and to actually change our social fabric to be able to move forward. I think I went longer than we were anticipating, and I'm grateful for your attention, and we'll try to find the screen that has the chats so that we can start to ask and answer questions. And I thank you very much for your attention.
So if anyone does have a question, please do write it on the chat. If you can't find the chat, then let us know.
There's the chat.
Hello. My question is, can traumatic brain injury come from emotional violence or not? Does it have to be physical violence?
So it's a wonderful question. When we define traumatic brain injury has to have a mechanical force. The types of domestic violence that you might be talking about are real and do occur. Those are not associated with traumatic brain injury and would fall more under the category of post-traumatic stress disorder.
Mm-hmm.
I have a question that relates to, is there an issue regarding the income level? Is more domestic violence with lower income?
We would make that assumption about income level, but there's absolutely no relationship between income level, education, race, age, when it comes to domestic violence and intimate partner violence. And then I'll take it one step further and tell you that the Maricopa County's police officers have, or the data that we have suggests that if there's violence from an unknown assailant, the likelihood of traumatic brain injury is much lower than if there's violence from a known assailant. And the analysis or the interpretation of that is that the unknown assailant has a specific goal, whether it's sexual intercourse or stealing money or mugging or robbery, whereas an intimate partner may have a deeper relationship and greater emotional ties, and then it leads to the traumatic brain injury.
Okay, Jonathan, can you hear me?
I can.
If somebody has a traumatic brain injury as a child and they've battled their whole life, how long after that can they seek treatment for it still to be effective?
Today.
Okay.
So many individuals who are living with long-term effects of traumatic brain injury are not really aware that their symptoms are associated with traumatic brain injury and therefore have never sought treatment. But suffice it to say, there are professionals in the medical fields as well as the therapy fields like occupational and physical therapy that have opportunities to provide resources that can either overcome or fix some of those injuries.
Thank you.
Hi, this is Leslie. Do you hear me?
I do. I also see your message.
Oh, you see the question. Okay. Yeah. Do most people, after this violence occurs, do you find that most of them go back home?
So this is the horrible, horrible statistic. The average is it takes a woman 7 times to leave her partner before she leaves that partner for good. And so the answer is yes, at least 6 times. In many cases, the violence escalates as time goes on, and the threat of strangulation and homicide goes up as well. Yeah. And so if you think about it, all these symptoms that I told you about traumatic brain injury, as they compile over time, confidence to leave goes down, ability to organize a retreat or a plan goes away. And so it ends up being
Vicious circle.
really a vicious circle and being trapped. Yeah.
I do have another question. It's kind of on the side though. Do a lot of people stay because of their pets?
Yes. Pets, children, and livelihood. No, not knowing if they can sustain themselves. The Sojourner Center has partnered with PetSmart, and they actually have a pet shelter. And they like to say they've got dogs, cats, turtles, goats, and a lizard. And so they definitely have participants in their shelter and in their system where those individuals would not have left if they couldn't have taken their pets with them.
Is there any ability for general practitioners to be able to recognize somebody who's not aware that they have the problem, where it can then be recommended to pursue?
I hope that one of the outcomes of this COVID-19 pandemic is that it permanently changes our healthcare system. The way in which our healthcare system is designed is you walk into a physician's office, they ask you what your chief complaint is, and you get treated for that chief complaint. Very rarely does a physician uncover something unless you bring it to their attention. And so in many cases, to answer your question, the individual doesn't know that they have the brain injury. And so they don't start the conversation with their practitioner. Not to mention that most practitioners don't necessarily have the training or the ready access to that information to help individuals or even recognize it. Part of what we're doing is raising this level of awareness so that everybody can help to identify these symptoms. If you think about the relationships that you used to have and hope to have soon with your beauticians or your manicurist or your dentist or your masseuse, these individuals actually spend more time with you on a more regular basis than your physician. And if they were alert to symptoms of traumatic brain injury or indications of domestic violence, then they can give you a victim encouragement to seek help.
That leads me to another question. I believe I read that I think it's Italy, the pharmacists have a code word. Do we have anything like that here for a person to go someplace and say a code word and get help?
So those discussions have actually started about 2 weeks ago to engage with the pharmacy associations in that regard. So the idea is you walk up to the pharmacist and you say, do you have any strawberry milk? And that's
right.
Code word for I need someone to come and communicate. We've also heard that on Facebook, there's something about selling mascara or makeup where you communicate and you just say, hey, is your makeup still for sale? which then can start that same dialogue. There's a problem with it, and that is many abusers are going to eavesdrop on many of the communications. So, you know, as soon as we try to alert individuals that there's a code word for pharmacists or on Facebook for seeking help, the abusers are going to hear it and be attuned to it as well. Not to mention their brains are likely working a lot better and be able to be attuned to that as well. Yeah, these types of engagements have gone on for centuries. There's something called I think it's called a red shoe card or a shoe red card. These were little business card types of things that women would wear in their shoes that had contact information and emergency information because theoretically their abusers weren't looking underneath their shoes. It is absolutely stark to think about the impact on society. Our good friends, the Kessels, ask, where does the funding for the program for the Sojourner Center come from? It comes from everywhere and nowhere. As you can imagine, this is not a sexy topic and it's very challenging to get funding. It comes primarily from two foundations in Maricopa County that gave us money to buy some pieces of equipment as well as to get the program started. But we're continually looking for additional sources of funding, likely from women-owned or socially active organizations. Again, the current situation that we're in right now, nobody knows where any money is coming from or the value of money. And we are optimistic that in future plans from the federal government, there will be allocations for this particular topic.
I see that there are other questions or people that have unmuted their mics. Does anyone want to?
Yeah, how did that happen?
Bev, did you want to start?
No, I've already asked my question, but my picture is gone. Anyway, but that doesn't matter. I've screwed it up. It doesn't matter.
Thank you.
Question.
Yeah, Ruth, is that you?
Yes, it is. Do traumatic brain injuries work in reverse? If you break a leg and the pain from that broken leg, will that cause injury to the brain because of the pain from the leg? Since there's a neurological movement from the brain to the leg, would it work in reverse?
Everything affects the brain. Absolutely everything affects the brain. I think an easier example to think about is spinal cord injury. So if somebody like Christopher Reeve falls off of his horse and breaks his spine, those axons that I showed you that cause breaks, much like the freeway car accident, as those axons are broken, there's going to be what we would call retrograde degeneration. It's going to feed back into the brain and actually permanently change the brain. And that's in a physical sense. If we go with a broken leg, the broken leg is going to change the way you feel, the way you act, and it is going to modify the way in which your brain works, but it won't be considered a brain injury or traumatic brain injury. It'd be considered brain plasticity or adaptation. The same way as if you were to all of a sudden move to Denver and now you're living at 6,000 feet instead of 1,000 feet, your whole physiology needs to adapt to that environment and your brain would change. But we're seeing that as adaptive change, not maladaptive change associated with the physical forces of brain injury.
Thank you.
I have a question. Children or an adult goes to the dentist. This is your mother talking.
I recognize your voice.
That sounds funny. Would a dentist be able to identify any form of trauma to the face or the skull?
So that's a phenomenal question, and I'm glad you've read the paper on this. When the abuse is focused on the head, neck, and face, there is real bruising. I showed you the cover of that Miss magazine from 1975. And we have phenomenal makeup these days that will cover up that bruise and for all intent and purposes allow somebody to go about their daily business. However, that same abuse likely caused lacerations inside the mouth, potentially to the tongue, chipped a tooth, cracked a hard palate, severed the frenum, which is a piece that connects your lips to your teeth. And so those parts of dentistry can be recognized and cannot be covered up. And so we did write an opinion piece encouraging dentists to pay attention and raise the alert if they were to see something inside the oral cavity associated with brain injury.
Jonathan,
By the way, Sojourner, I believe, is a 501c3. They do accept donations from the general public.
They do?
And I think if you have quality clothes, they will accept women's clothes also.
Even male clothes, because they do shelter children up to the age of 18.
Yeah, I actually took a tour there. One of our donors actually is a very big supporter of Sojourner. I also support it. And they have a really fascinating tour. I know now it's closed to the public, but
right,
where they really show you what they do. If anyone wants that, when everything gets back to normal, I'm happy to connect you.
Leslie, you're on mute.
Okay. You mentioned the female partner and possibly the same-sex couple partner. Are you seeing, I imagine you're also seeing a rise in the LGBTQ couples?
Yeah, so the documentation on that is, yes, elevated levels, and I'm assuming you mean elevated levels as a result of the current pandemic. Those data are not yet quantified, but yes, we would assume the same is true. Does that answer your question? In general, the transgender population also is at a higher risk and a higher incidence of abuse as well.
Right.
I see that your dad has a question.
you did some work with the NFL and the head injuries and traumatic brain injury to the retired players. What changed in the NFL in the last 5 or 10 years to protect the players?
Their helmets.
I think that's a totally different topic. One is fear of the players getting head injuries. That's just caused them to quit earlier or retire earlier. There's been change in practice. There's been change in the rules, and there's also been increase in fines for different types of activities that causes change in behavior. What hasn't changed is the number of times that brain injured NFL players beat their wives and girlfriends. And what hasn't changed is the penalties for those players for even being called out and convicted of said abuse.
Yeah, they're protected.
Sure. Because they can afford expensive attorneys.
Bev, did you have another question?
No.
I have a question.
One sec, Bev, start over.
Disease with injuries to the brain.
The first part of your question got cut off, so start over. Sorry about that.
Is there a relationship to Parkinson's disease down the way for people who've had traumatic brain injuries?
Yes. There's a relationship between Parkinson's, Alzheimer's, and ALS, amyotrophic lateral sclerosis. It's not a one-to-one that if you get a head injury, you will get this disease. We actually don't know the true incidence and relationship between it, but the risk factors and what are called odds ratios are too high for it to be a coincidence. Does that answer your question sufficiently?
Yes, thank you.
Someone else started speaking right before that. Did someone else have a question?
I had a question. When you have a sports-related traumatic brain injury, and you talk about improvement, is there, what kind of improvements or what kind of remedies can you do for that?
Do you mean recovery of function? Is that what you mean about improvement?
Well, once you have the traumatic brain injury, and you start to develop Alzheimer's or any of the other bad symptoms, is there anything that can abate that or help that?
So a perfect example, and sometimes it's easier to use a single example, is Kathy Gifford.
Mhm.
So Kathy Gifford had what's called a penetrating brain injury as a result of a gunshot wound.
Right.
And she was severely disabled. She was actually about to be declared dead. And through rehabilitation and nutrition and a positive attitude and being honest about her symptoms and seeking treatment, has been able to make a remarkable recovery. However, she's obviously still living with the disease in that she has some speech impediment, some movement issues in her arm, and some balance as well as fatigue associated with it. And so what can be done, it depends on the symptoms and it depends on the willingness of the particular survivor as well.
But if you look at so many of these football players, for example, what do you do with someone like that?
Football, I hate to say, is a 1% or less of the population, and they are in a very unique category. When we talked about all the risk factors and the comorbidities, their nutrition, their substance use, both licit and illicit substance use, their lifestyle, all contributes not only to the disease, but to their recovery as well. And so it's a real challenge. When it comes to an individual who may have some late stage neurological disease, Parkinson's, Alzheimer's, Huntington's, or something to that effect, then the neurologists are going to treat that particular aspect of the disease, not necessarily the brain injury part. Brain injury as a whole is a constellation of symptoms, and for now we treat each individual symptom, whereas Alzheimer's disease is trying to come up with a single drug to overcome the degeneration or a skill set, whether it's Tai Chi or crossword puzzles or Sudoku, to reinvigorate the brain. Exercise seems to be seems to be one of the best things that we can do.
Mm-hmm. Thank you.
You have 2 questions in the chat.
Is there a way to educate people so that before abuse happens, how to be financially independent? In the state of Arizona, our education system is woefully underfunded. And we often pass regulations on what can and can't be taught in school. And so there needs to be a fundamental change in that aspect. And unfortunately, in many of these situations, as one of the questions commented on, there's a cycle of abuse here. If you grow up in a household where this is normal, then when you become an adult, you think that this is normal as well. And so breaking those cycles goes far beyond education. It goes into peer support, social networks, and other types of activities that require a change in the way in which we view our social framework. Interesting question. What is the penalty for domestic violence in Arizona? I'm not the right person to answer this question. I've sat in on many meetings with our prosecutors and our district attorney with regards to this. I think it was about 8 to 10 years ago, the state of Arizona changed our statute so that strangulation was a criminal offense. and it comes with severe punishment. The problem with traumatic brain injury is that we don't have a way to quantify it or associate it such that we can assign a penalty. And so it's just a physical assault type of designation. When it comes to domestic violence, the burden of proof is to show that the lingering symptoms and the result of it are a consequence of the most recent event. So if you walk in and you say, this person did this to me, and I have these symptoms, a attorney on the other side is likely to say, well, didn't you have a previous partner and didn't they abuse you in the same way? How do you know those symptoms aren't from that individual rather than the current individual? And when the burden of proof is not beyond a reasonable doubt, the conviction goes down. And so unfortunately right now the penalty is very low. That being said, the reason that our county attorney is on board with us is to change that, is to change those statutes. Ruth asks, are there any data regarding elder abuse and brain injury? Yes, I didn't highlight it in the slides that I showed you, but on the y-axis from our Arizona epidemiology, that goes all the way up to 100 years of age. And there's definitely still domestic violence and brain injury in individuals in their 60s, 70s, and 80s.
I see Bev has another question.
Oh, perfect.
I'm sorry, I was just going to ask you if it follows in your experience that mothers who are abused will find their children being abused by the same man, or do they normally just stick with their partner with the abuse and leave the kids alone?
The answer is yes. Both of those occur. Again, I'm not a social worker and I don't study domestic violence per se. We have many domestic violence experts on our teams. The information that's in the literature suggests that any and all of that can happen. There are, well, to give you the third situation is that children see mom being abused and will intentionally step in the way to take the abuse to protect mom.
Yes.
And so it's all of them. Yeah, it's a harrowing situation that is very real. We didn't get into the nitty gritty of the details, but it's 1 in 4 women have experienced domestic violence at some point in their life, and it ends up being about 1 billion people on the planet that are affected by it. So if we take the 1 million Americans who are affected by COVID-19 or who have been diagnosed with it, and we translate it to 1 billion people who are affected in this way, we're looking at a substantial increase in the incidence and the impact.
Yeah. Wow.
I don't know to what extent the would be brain injuries to adults, you know, like in retirement homes, but I do know that there's violence by the caregivers, and that's something adult children have to be aware of, because oftentimes the parent is not able to express themselves.
Yes, yes, it happens across age and across location and everywhere else. It is pervasive, including infants. So shaken baby syndrome, you've all heard about shaken baby. It's not shaken baby, it's domestic assault on an infant.
Yeah.
Is really the way it goes. It is profound and it is everywhere. And our primary goal is to create a venue, a forum just like this one, where we can have a conversation, you know, where we're not trying to put up our guardrails and say that we live in a utopia where this doesn't exist, but we're opening our eyes to the situation, and we can become advocates for ourselves and for each other on this topic, because this topic shouldn't be a topic of discussion in 2020. but it is. And so the team that we have assembled locally and nationally is to try to change that permanently.
All right, thank you so much. Is there any last question, or should we close it up? And if you have a question, you can email me and we can send it to Jonathan. Dr.
My only comment is that this was more than just entertaining. This was highly, highly informative. Thank you very much.
You're welcome.
Yes, thank you.
Thank you very much, Doc. And thank you to Izzy and Pinky for connecting us on this one. We really appreciate that.
Thank you, my sweetness. Look at that smile.